Local productions seen on Delta College Public Media are made possible with support from viewers like you. Thank you.
Hello, everybody. This is Junia Doan, and this is Junia Doan's The Spark. Thank you for tuning in. The date today is May 1st, 2020. I have been self-sheltering for 6 weeks per governor edict, and she has just announced last night we're going to have another 28 days of self-shelter in response to the threat of the Wuhan virus, COVID-19. So I thought it would be interesting if I talked to some people around who are by their professional work are making our lives easier by the adjustments they've made. Today I have with me Dr. Pankaj Jandwani, and Regional Vice President for Medical Affairs and Chief Innovation Officer for MidMichigan Health. Well, I'm thrilled you could be with us today, and thank you for taking time out of your, I'm sure, busy schedule. So I'm interested in actually, what are your responsibilities? You've got two important titles, and it must cover a lot.
Sure, it keeps me busy for sure. So thank you for having me, first of all. Really good to be here. So I have two roles. I wear two hats. One is as the Regional Vice President for Medical Affairs, and the other hat is as a Chief Innovation Officer for the system. So in my regional hat as a VP for Medical Affairs, I work with the physician leaders in the Midland and Central region for MidMichigan Health. Central region for MidMichigan Health includes Gratiot, which is Alma, Michigan, Mount Pleasant, and Clare, and of course the Midland region. And I work with the physician leaders like Chief of Staff for medical staff, the Vice President of Medical Affairs for each hospital, and other leaders like Director of the Hospital Medicine. And I work with them to, of course, improve quality of care, safety of care. We make sure that we are complying with all the requirements of Joint Commission, other regulatory requirements, and of course, often there are some safety issues or compliance issues that I get involved with, and I help improve the processes working with the medical staff. So my role really is to partner the physician leaders, support them with the administrative leaders. And always healthcare is a partnership between the technical medical side of what we know to be the best way to care for patients. And then we have to make sure that we deliver that on a day-to-day basis to all our patients everywhere, not just in the biggest, largest hospitals, but also in all our communities, rural communities, critical access hospitals. So that's my role as a Regional Vice President for Medical Affairs for the Midland and Central region. And then I have a system role as a Chief Innovation Officer, and that is evolving and developing, as you can imagine. Innovation is something that, of course, healthcare depends on. We have to rely on having science evolve and learn more, as we've learned with the COVID situation. But how do we make sure that we know what's the best evidence out there? Looking at a lot of publications, working with the universities, and then looking at our processes and improving them on an ongoing basis. So I get involved, and I have a very good team to help support some of those. Not only how do we know where we need to improve, but also what are the new things like, and we can talk about that for our COVID discussion, because that became really an important piece on how we needed to respond, both with use of technology as well as just new ways of doing things that we had to figure out really on the fly, because this was just presented to us with no advance notice.
All of us.
Yeah,
Right.
all of us. Yes.
So what I'm I'm understanding. It's an interesting combination of responsibilities. On one hand, it's compliance with regulations,
Yes.
right? Because you're heavily regulated, as
Right.
is all hospitals.
Right.
And two, it's taking the processes that comply with the regulations and making them more effective in terms of health and other measures for the patient, for the hospital, for the bottom line.
Yes.
There's a lot to consider there. One of the things that interests me about this virus is I don't have a technical background, and that makes me super curious always. But it seems like, from what is public information, that it manifests not only differently, but it to help the patient requires almost a trial and error, because there isn't a standard for efficacy, for really help. And at the same time, we don't even know yet how it's transmitted. I mean, you can be a carrier and then you can get sick, and when you're a carrier, but symptoms you don't know. It just seems very elusive at the moment. And therefore, that innovation side of your responsibility must be exploding with, well, should we try this? Should we try that? How do we handle this? Will that infect this? Will this retard us? Talk a little bit, if you will, about the process of treatment when there isn't a standard currently.
You put it very well. We were essentially presented with this just out of the blue, and we had to figure out how to respond to that. And this can happen, obviously, in many situations. This was a pandemic. The entire world was presented with that. But we have to always remember what we do know. And the basics always have to be, we have to remind ourselves and trust our fundamentals. So obviously, we have good processes already in place for infection prevention. So we have to start there and make sure that what we know, that we are using all of those processes to begin with. And that was our focus as soon as we were presented with this. So what do we know? How do we make sure that we use either universal precautions or additional precautions based on the kind of pathogen we are suspecting? And of course, that wasn't just the challenge. Yes, of course, we didn't know how the virus transmits, but also the supplies of all those PPE, as you read enough in the news and media. So and I think our processes have to be consistent, reliable, and our employees, our physicians, our providers have to all be comfortable in using all of those, because there is one thing on having the supplies and having the PPE. There's another thing on using it properly, because if you don't use it properly, then again, and that is what innovation at MidMichigan Health is that we always evaluate what do we know for sure and how do we know that. And so we always rely on fundamentals, the foundational knowledge, and going back to either listening to CDC or the American Medical Association, the American colleges, societies, and of course we are partners with the University of Michigan. So we always have that as a resource, and we always connect with our colleagues at Michigan Medicine and making sure that we understand where's the evidence today and how are we going to make sure that we understand where we are, what is approved by the FDA in terms of diagnosis and treatment, what is CDC, what is the health department telling us, and we make sure that we, after reviewing all of that, of course, I don't do that by myself. I have a lot of help. I have a lot of of course, senior physicians, senior leaders, a lot of knowledge in the organization. So we make sure that we are working as a team, as a group, and are after we have evaluated it, we make sure that we put it together in a very concise format and it's communicated. So, and all of that is, that's what the organization has to do to make sure that we are not just innovating, but we are actually able to provide that latest and greatest innovation to our patients all the way through. So I don't know if that makes sense. It's a long answer.
It does. It just seems you've got a lot of bosses there.
Well,
in terms of regulatory applications.
Yes. Well, and I think we can count on a lot of those sources, right? So we don't have to figure everything out on our own. We can rely on the scientists to figure that out. We're still waiting on so many studies and trials, right? And again, whenever you put something like a treatment to a patient, you want to make sure that you are, one, very transparent about what do we know, how do we know it, there is evidence behind it, and we can share that evidence with the patient because there is nothing absolute in medicine, for that matter, in anything in the world, but for sure in medicine, we always want to make sure that the patient or the person that we are communicating and treating understands what we know and how we know it, and they can make that decision with us.
So you've had an interest, and the hospital's had an interest in physician burnout.
Yes.
From what I read again, this is such a high stress situation for the medical personnel and probably the cleaners, everybody. Are you thinking about, or what do you do for, I can't call it burnout, but just the physical and mental stress and spiritual stress of treating and losing perhaps?
Yeah, no, that is a huge focus for us. I work with a team. We have a provider wellness and burnout council. I don't know if you've heard of Dr. Kate Regan. She is one of our leaders. She's a psychiatrist and has done a tremendous job in leading the council. And we've been on this journey for now, I'd say at least 3 years or more, where we have measured burnout in our providers. We have actually significantly improved burnout in our providers and continue to do a lot of things. And so all of this was in place before COVID presented in the way it did. So the kind of things that we already have in place, besides having the council that meets regularly, and it's made up of not just physicians, but physicians leaders, our administrative leaders, senior leaders, and we have put in place a wellness retreat, peer support group, a lot of initiatives where we measure how our providers are feeling and address their burnout. So that was already in place. As COVID situation presented itself, of course, that presents another level of stress on top of whatever else was going on. Just starting with the fact that as you have the emergency room physicians and hospitalists presented with the patients that might be positive, and now they receive a result that's positive. There's a lot of emotional stress. Am I going to be okay? How am I going to treat the patient? Of course, they're having these conversations with not just patient and the nurses as well. So we made sure that we as leaders reach out to our providers and nurses. And we've had actually a regular webinars and conference calls. We actually, our providers had calls with Kate. That was the title of that conference call, and they were able to talk through a lot of those discussions, a lot of those scenarios with Dr. Regan, and she does a phenomenal job. We're very lucky to have her.
You were part of this hospitalist movement, which I understand once a patient is ill and hospitalized, that whoever has that title takes over the care of the person. But how does that play out now with this particular virus when we don't really know what to do? Are there group meetings that involved more than the hospitalist, or how have you decided to deal with that?
So in a typical scenario, you would have someone who develops symptoms consistent with the presentation with COVID-19. That would be they will start to develop fever, shortness of breath, cough, and all the other symptoms you've read about. They may not all be present. They will typically present to the emergency department, and emergency room physicians and team will evaluate that patient. After the evaluation, they will determine whether or not this person can be sent home or do they need treatment in the hospital. Usually hospital admission is done when someone requires oxygen, IV treatment. Of course, if they're worse in terms of requiring ventilator and intubation and those sort of things. In that situation, the emergency room physician will call a hospitalist. Hospitalists are usually either internal medicine, hospital medicine, family practice, specialty providers who have taken special interest in training and have been providing care for patients who are admitted to the hospital for medical care. So these providers work only in the hospital. They would do shifts of 10 to 12 hours and work in teams. And they would consistently take care of patients who are admitted in the hospital in their service.
So with your background, you're probably familiar and even practiced at one time or been a patient of Ayurvedic medicine. To the extent that that might help one of the patients here, would it? Not to personalize any particular patient, just looking for, maybe we're not even allowed to draw from different approaches when people are sick.
So I'm trying to understand your question. Could you just elaborate that a little bit more?
Ayurvedic medicine comes out of India, right? And they have a whole system of supporting the body and so forth, and treatment and how you should live and what you should eat, and do you want to eat only hot foods or cold foods or something like that? Are there any other traditions like acupuncture or Ayurvedic that might support, or does the hospital use any of that to support the health or the remediation to health in a way that might be not only useful to the patient, but speed up the recovery?
So there is no doubt that patients, our families, we all need more than just medicine to get better. And that includes support that's emotional, spiritual, nutritional, physical, all of that. So I think in terms of supporting recovery for our patients or patients in healthcare in general, of course, making sure that there is availability of all these disciplines and resources, it has to be part of the recovery process. And of course, we provide that at MidMichigan Health in terms of, we are always talking to them about, family support, education, making sure that we have physical therapy, we have dietitians, and spiritual care. All of that is part of the recovery and treatment. We are Joint Commission certified, so that, again, going back to the regulatory environment, we are certified by the Joint Commission, and that's the regulatory body that ensures that we are following the evidence-based protocol and process, and that is part of our commitment to quality and safety. So we work within the constraints and realms of that discipline, and obviously if there's something that's probably okay in terms of being available as a nutritional supplement, we would not use that in the hospital to treat patients unless there is a well-supported documentation in a peer-supported, peer-reviewed journal and a recommendation by an American college or society. And that's the part of making sure that we maintain that standard of care for our patients. So we would make sure that whatever we are providing to our patients is FDA approved, and is either in a society guideline, or it really is there is an evidence-based practice to recommend that. And if there is something that has not been yet supported, well then of course talking about treatment for COVID, MidMichigan Health has actually partnered with Mayo Clinic in using the convalescent plasma for treatment of COVID. Now that is a very separate process where you make sure that that's a research protocol, and you would follow all those requirements when you offer that to the patients. And that's a consent process, and we go through all of that.
So I want to focus a little bit in just with COVID for one question. It seems to me there's the ventilator. It seems to me there's saturated or more oxygen, the high altitude approach. Then there's this other remedy. And where along the line do you have options to choose one or another? Or once you've gone in one direction, find it doesn't work, you've really lost the option to try something else?
This information and knowledge and how the clinical progression happens with COVID-19 is still evolving. We're learning every day. obviously we are learning more and more as we've had more exposure to some of the experience that others have had in trying certain things. Now, again, what you might hear about one case or one instance or experience of one institution is what that is experience of one individual or one institution. We have to just remember that the word is not out yet as final word on this, as more journals are publishing that every day. So, and that's where we have to be very cautious in saying this is better than the other treatment until we have that final word. And usually that happens. And a lot of people are working very hard to publish that data. They're working very hard to, as you know, recently we've seen more and more publications come out where we thought one drug might help, and of course we're still evaluating that data. So again, and I think our job as providers, as physicians, is to share that with the patients. And of course, yes, patient in need, they need that treatment, or they need some treatment now. They can't wait for that trial. And that is a good dialogue between the physician who's treating the patient and the patient. And I think they make that decision in the best possible manner. And again, we can't say that always works because we don't know. A treatment would always work for all patients. That's a conversation between a physician and a patient. And we trust that relationship to do the best for that patient.
So you have a bit of a background in rehabilitative, say it correctly for me, medicine, and also in geriatrics.
Yes.
So I have read in recent years that, especially from friends who have hip problems or knee replacements, that the trend now is to ask them to get in shape before they do the surgery. Absolutely. If you were advising the general population now to get in shape in case they got this virus, what kind of shape is that? I mean, is it aerobics? I mean, give me an idea or two.
So always for any musculoskeletal issues, the foundational aspect of recovery is your muscle strength. How good of a shape are you in before you have any treatment? And your chances of recovering from it are dependent on that. And so now again, there isn't one particular type of exercise that always works. There is no silver bullet to that, as you know that. Really, it is about making sure that you are always challenging yourself to achieve a better level of tolerance and fitness and strength and flexibility and stretching, all of that. And as I took care of a lot of patients for over a decade in the inpatient rehabilitation center. So I saw a lot of patients who had their hip or knee replacement or had hip fracture and or had a motor vehicle accident and they were in the rehab center. So my role at that time was to really make sure that they built up their strength to be able to take care of themselves. And because really recovery of a surgical incision or an injury is going to be taking its own time. What's most important is, are you gaining your strength back? Because as you go through the recovery process, just laying in bed, as the longer you don't do something, the more you will lose the strength to do anything. And so our mantra always was, if you don't use it, you lose it. And so
over a short period of time, I read.
It happens very quickly. That's correct. So again, I think it goes back to, if you built up your strength, your flexibility, your and do all of your what you're supposed to do, not just aerobics, but strength building, stretching, all of that. I think that sets you up for success. Whether you go through an injury or if you need a surgery or procedure, your chances are much better if you're in a better shape.
And what would you recommend on the mental health side? I'm reading people are very distressed because they're at home, and of course they may have job issues or health issues, they can't get attended. What's the best innovative thing you can suggest?
Well, I don't know if I have a silver bullet for avoiding being stir crazy. I think we all have experienced that for sure, myself included. I think change of environment, and again, going back to physical exercise, one of the The best thing is where we live, Mid-Michigan area is beautiful. We have so many areas to walk, trail, do outdoor activities. And of course, there is no restriction on that. So there is no reason for any one of us to be cooped up all day, unless, of course, you're working all day. We find ourselves in front of the computer, but really, it is about getting out, spending time with your family, making sure you're connecting with people, making sure you're making phone calls, just checking on people. And yes, we have to follow social distancing, but there is no reason not to step outside a neighbor's home and just wave hi and smile and have a chat. So I think that goes a long way. I think as humans, we have to find connections. And when we stay connected, we have a sense of belonging. I think that fulfills our wellness, our well-being. And I think that's really, if there is one thing everyone can do, I'd say that's it. And just making sure you stay connected. Whoever that is in your life, whether that's family, friends, neighbors, church, any social group you're part of. And yeah, online connections like we're having right now also is part of that. But getting outside, moving, being part with the nature, enjoying the nature, and encouraging others. I think there is a lot to be said about that. And one final thing, gratitude really goes a long way. Be thankful for what we have, making sure that we express that to others. That fills a cup every single day.
Thank you very much for sharing your wisdom and time with us. My secret, it's not so secret, it's just my general attitude. I like to laugh. So when things blow up or something terrible, I generally say, it isn't funny now, but.
Yes, absolutely.
And I tell the story years later, right? Yes. There'll be some funny part of it. And I think that laughter actually is as important as anything else we do. And if we do that, we have a moment of enjoyment. So again, thank you, and I'll see you around. And be sure to tell me anything innovative that comes up.
I will certainly do that. Thank you. Pleasure.
To contact Junia, send her an email at juniadonsthespark@gmail.com. For more information, program schedules, and news about future guests, go to www.juniadonthespark.com. Thank you for joining us. See you next time on Junia Doan's The Spark.
Local productions seen on Delta College Public Media are made possible with support from viewers like you. Thank you.